Is it bipolar 1, 2, or 3? The main difference between bipolar 1 and 2 has to do with the duration of symptoms. So in the last video, I talked about how hypomania is diagnosed when symptoms are 4 days or longer, and that diagnosis changes to mania once the duration hits a week. Now, historically, people have said that the difference between bipolar 1 and 2 had to do with severity, with bipolar 2 being less severe. But bipolar II is no longer thought to be a milder form of the disorder because of the amount of time people spend in depression. In addition, the instability of mood in bipolar II can still be bad enough to cause serious impairment in work and social functioning. Beyond the duration, the essential difference between bipolar 1 and 2 is that people with bipolar I disorder experience mania and may or may not have depressive episodes, while people with bipolar II experience hypomania and depressive episodes. So bipolar I is mania and maybe depression. Bipolar II is hypomania and depression. Hope that kind of clarifies it and simplifies it. So it can sometimes take years to diagnose a bipolar disorder after a person initially experiences symptoms, as much as a decade or more, I've seen in some cases. Why is that? Well, one reason is that people with bipolar disorder often present to a doctor when they're depressed or down versus when they're up or feeling pretty good. So the focus of the visit and the treatment at that moment is on that depressed mood state. So this is why a thorough clinical interview is so important. This type of interview looks at history and patterns to see if there's a greater context for the depression. It involves going deep into the past and looking at the person's life up until that point, not just an isolated visit. Another reason that it may take some time to get an accurate bipolar diagnosis is that some people with mania or hypomania so enjoy how they feel during those times that they don't want to give it up. So they suffer in silence with the depression, just waiting to feel good again. The benefits outweigh the costs, if you will. So also, because hypomania can be mistaken for ordinary happiness or even typical functioning, bipolar II may be misdiagnosed as depression alone, what's known as unipolar depression. Now, shifting to bipolar III. Cyclothymia or cyclothymic disorder is unofficially called bipolar III by some people. That's not a DSM diagnosis. It involves hypomania, as in bipolar II disorder, that frequently alternates with these brief periods of depression. Now, the difference is that the symptoms of depression are not enough to meet the criteria for a diagnosis of a major depressive episode or disorder. Unlike bipolar I or II, though, this type of bipolar disorder has a time requirement. So symptoms of the hypomania and depression must be present for 2 years or more in adults and 1 year in children. Now, many consider cyclothymia to be a milder form of bipolar disorder. People who experience this disorder, though, still suffer a great deal from their hypomanic and depressive symptoms. So it's definitely still worthy of the full treatment protocol. Follow me for more on the bipolar disorders as we discuss 4 other types next time. Thanks for watching.